We are requesting in the appeal a record operational budget of more than 1.3 billion implemented by a staff than more than 14,000. It's an increase of 25% compared to last year, and it's definitely responding to crises in the world which have ever deeper impact on populations. Systems are falling apart, whole regions are in conflict, people are displaced. ICRC is responding to those challenges, and that's the reason for the increase. Syria, the Middle East, Syria, Iraq, the impact of the Syrian and Iraqi crisis on neighboring countries, Lebanon and Jordan in particular, will continue to be first priority for ICRC. South Sudan will be another important context in which ICRC is delivering in many parts of the country as the only actor really responding to the crisis. The Sahel, Afghanistan, Ukraine will continue to be of concern to ICRC. One of the difficulties is that we have been used to design programs according to countries. We have always dealt with crises in a country. Now we are dealing with big impact into region, and therefore we have to connect those programs and to see the communalities of some of the challenges with which we are confronted. Indeed, when I look at the landscape of conflicts, there are recurring issues which we encounter from north to south to east and west, and the attack on health workers and the violence that health facilities are exposed is one of those issues to which ICRC has responded with the important Healthcare in Danger initiative, which has to continue next year because the problem remains as topical as it has been in the past, and raising awareness on this issue is critical. Sexual violence is a relatively new issue that we are hoping to expand in our program next year. It's a hidden issue which victims do not so easily talk about, but looking at some of the recurring problems with which we are confronted, we came to the conclusion that it is important to address this issue much more prominently, so it features as a real thematic priority in the 2015 budget.